Hello, citizens of Shelby County. This is Dr. Bruce Randolph, the health officer for Shelby County. I'm here to present the update on our data. Currently in Shelby County, we're reporting 19,694 total cases, 528 new cases. However, these new cases are reported cases over several days. Total deaths, unfortunately, is 263. Of the 19,694 cases, 13,901 have recovered. We're seeing some improvement in our positivity rates. Our daily positivity rates have leveled off and actually are decreasing. And we're beginning to see some other downward trends, such as the decrease in the number of days it takes to double our cases. In early July, it was taking approximately 26 days to double. Now we've extended that to 30 days. And the best explanation for these changes and the positive progress we're making is the wearing of masks. We believe that wearing the mask, facial coverings, have had a great impact on our rate of transmission. We asked the University of Memphis School of Public Health to conduct a study looking at the use of masks. And we have today as a guest one of the students who participated in this study, Gabby Dowdy. She's a student at the Public Health University of Memphis School of Public Health. She will come and she will present the results of this study at this time. Will you, Gabby, come to the podium?
Thank you, Dr. Randolph. Thank you, Mayor. Good afternoon. My name is Gabby Dowdy. My colleagues Geraldine Carmichael, Eric Calabaway, and Becky Cronenberg and I are honored to be here to present our data to you. We're thankful to Dr. Haushalter and to the University of Memphis School of Public Health for this opportunity. We have been measuring mask use compliance in Shelby County. The purpose of our study was to measure the mask adherence with the Joint Task Force recommendation for mask usage to reduce the COVID-19 transmission. We hope this data would inform communications and policy strategies to help improve compliance. Next slide, please. We counted the number of individuals who were correctly wearing masks. We did this via two methods. One was via direct observation in 20 large retail settings. We went to 10 stores in high transmission zip codes and 10 stores in low transmission zip codes. High transmission areas are the zip codes with a higher rate of cases per capita. We also reviewed videotapes of city cameras at popular outdoor areas such as Highland Avenue, Madison Avenue, and Beale Street. Next slide, please. So we collected data pre-policy and post-policy, which was the mask ordinance and the health directive. So pre-policies, the overall mask usage was 51%, and we observed over 4,000 participants. Mask usage by age was 35% for those 2 to 18-year-olds and 64% for those 55 years and older. Correct mask usage was a bit lower, with the correct mask being over your nose and mouth. 2 to 18-year-olds, only 31% wore their mask correctly, and 61% of those 41 years and older wore their mask correctly. The lowest mask usage was seen in the Hispanic community with only 34%, and the Asian community had the highest mask usage with 91%. Post policies, the results were significantly higher. We observed nearly 4,000 people, and the overall mask usage was 92%. The mask usage by age increased, with 85% of those 2 to 18 wearing a mask, and 94% of those 41 years and older wearing a mask. Correct mask usage was also increased, with 78% of those 2 to 18 wearing their mask correctly, and 92% of those 41 years and older wearing their mask correctly. There was an 88 to 92% of mask usage among all ethnic and gender groups. There was only a 1 to 2 higher rate of transmission of compliance in the low transmission zip code. Next slide, please. So the video surveillance was also done pre and post policies. Pre-policy, we observed 23 hours of videos, and the correct mask usage never exceeded 60%. In 21 of those 23 videos, only 2/3 of people did not display proper mask usage. Post policies, we observed 21 hours of videos. The highest rate of mask usage was 67%. In 17 of 21 hours, at least 60% of people did not display proper mask usage. Overall, in outdoor public spaces, data indicates a slightly better compliance with the city mask ordinance and the county health director. However, the results were still far from optimal. Next slide, please. So we do have a few recommendations. First, we need to ensure correct mask usage so that everyone knows that the mask should go over their mouth and their nose. So to do this, we suggest perhaps commercials or internet ads that explain how to properly wear your mask. We should also focus on those groups with the lower compliance, which was the 2 to 18-year-olds. So perhaps YouTube videos to target children, and maybe TikTok videos or Instagram to target teenagers and young adults. We should also do observations at smaller retail stores. We only went to large retail stores for this study, but we should look at gas stations and corner stores as well. We should also enforce correct mask usage, even when people are just going in to pick up to-go food, just running in and out quickly, or even just going in to get gas and coming out quickly. They should still be required to wear a mask. Next slide, please. Lastly, we would like to acknowledge those who really helped us along the way: Dr. Levy and Dr. Nolan from the School of Public Health, Dr. Haushalter from the Shelby County Health Department, Dr. Jane, Dr. Warren, Deputy Chief Don Crow, and all those who participated in the mask usage survey. We really thank you guys for your help.
So I want to thank Ms. Dowdy for that very comprehensive report around their efforts to ascertain masks and how masks are working. And you can tell from the report from Ms. Dowdy and the other students and faculty from the School of Public Health that masks are one of the best strategies to help us combat the spread of COVID-19. So shout out to the faculty at the School of Public Health and Dean Gurney and all the rest that contributed to this. And also she mentioned video cameras, the video observations, so shout out to the Real-Time Crime Center for allowing the use of those videos. I am just here to give a quick response about the number of confirmed cases that you heard from Dr. Randolph and you saw in the report this morning. The number of confirmed cases is relatively high, and it reminds us that we are not out of the woods at all yet. It reminds us that we have a lot of work to do and that things may darken before they abate. We know that this community and we know that the neighboring communities are all working very hard together and meeting regularly. We know that we are coordinating the response, but we also learned this week that we are unlikely to see a state solution on masks or bars or other social settings. So statewide intervention on some of these issues, in my opinion, would be helpful, and I'm hopeful that some of those decisions will be revisited. For now, let me say that we can't ignore the reality that our cases are likely to move up and down and move around a bit for the foreseeable future, and we have to be prepared for this new normal, even though there's nothing normal about any of this. We have to be prepared to continue to work until there is a treatment or there is a vaccine identified. The good news is that we can slow the spread and we can safely and responsibly reclaim community. The current state of affairs only requires each of us to keep working. We have slowed the spread once, and we have to continue to work at this. We know how the virus is spread, and we know what each of us have to do. You heard the report from Ms. Dowdy just a few moments ago, and that masking does work. We just need everybody to embrace this new normal. So I'm just here to remind everyone to please remember to socially distance, to wash your hands, and to please mask up. At this time, we'd open the floor for questions, and I'd invite Dr. Randolph back to the podium. Thanks.
Jody Lewis with WREG.
Can you guys hear me?
Yes, go right ahead, Jody.
Okay, my question is first about the increased cases of 500 plus today. Dr. Randolph, you indicated that these are cases that have been reported over several days. What's being done to address the labs and to get more accurate daily reports in a timely fashion? And then my second question is, we're seeing positive data with masking. Are you concerned, though, that people may be getting a false sense of security, thinking we can still gather and carry on if we wear a mask?
Okay, to address your first question, improvement has occurred within the labs. Two issues were, one, the availability of the reagents, and secondly, just the increase in the demand for testing. The labs have improved their capacity and have improved the availability of the reagents. Therefore, there is improvement in getting results out quicker. Our expectation is that within the near future, the length of time that it is taken to get reports back will be lessened. And so currently, those numbers that you see, 500 plus, is the result of several days of testing. To answer your other question about the masking, I think, and I'm hoping that the decrease in numbers as a result of using masks and facial coverings will encourage people to be even more committed to wearing the facial coverings and the mask, because we see the results. We see that it is the thing to do if we want to try to get back to any sense of normalcy. If we want to be able to do things, we must wear the facial covering and the mask. This virus isn't going anywhere. We must learn how to still function and exist in spite of, and wearing the mask is the way to do that. Now, with that said, wearing the mask, you still need to maintain 6 feet separation. The mask doesn't give you the liberty to still be crowded and be up close to people. It's mask and 6 feet separation, at least, if not greater. So it is very important that you still avoid crowds, still avoid close contact. You still maintain your social distancing and wear your facial covering and your mask.
Omar Yusuf with the Daily Memphian.
Hello, can you all hear me?
Yes, go right ahead.
So my question is for Dr. Randolph. So at the beginning, you all set a benchmark of 10% for the overall positivity rate, or that's the rate you didn't want to hit. How did you all come up with that number?
That number is a number that is actually used nationally and even globally. The idea is that you want your positivity rate to not exceed 10% of the test that you perform.
Omer, your follow-up?
I do not have a follow-up.
Great, thank you. Sam Hardiman with the Daily Memphian. I'm sorry, Sam Hardiman with the Commercial Appeal.
It's very nice of you to make me a member of the Daily Memphian. Thank you. To ask, my first question is for Mayor Harris, and then I have a follow-up. Mayor Harris, you said that you would like to see a statewide mask mandate, and you would like to see more statewide action. Given that the county runs its own health department, what actions are you precluded from doing now?
So I don't know that we're precluded. It was a mention to remind us that the borders are out of our control, and even though we're working with our neighboring partners a great deal, some of those neighboring partners don't have some of the powers that they need in order to slow the spread. And so that was just a shout out to remind folks that we're probably not going to bend this thing to zero because of the border issues.
Sam, you have a follow-up?
And then my follow-up is to follow up on Omer's question. Now that our local positivity rate is over 10%, does that trigger any sort of response from the health department, or is this another number where we're sort of watching and waiting and seeing as to what it does, particularly with greater mask compliance?
Yeah, I think we're hopeful that the masking will have some positive effects. And in fact, we've seen some positive effects. You've heard the report from Ms. Dowdy. And so we're really hopeful around that. The positivity rate is also used to think about the reproduction rate. And the latest reports on the reproduction rate is that we had seen some positive movement in the reproduction rate. So our reproduction rate, in other words, had moved down just a little bit over the last several days. And so I think we're evaluating the data, and the data, of course, is going to drive all the decision making.
Bradley Broders with Local Memphis 24.
Good afternoon, everyone. This question can go to both Dr. Randolph and Mayor Harris. I'd just like to know just your reaction to the school district since our last briefing on Thursday, doing some adjustments, Collierville going to the hybrid model, SCS going all virtual for the time being. Just your thoughts about the changes there, and can different districts across the county operate differently and safely at the same time? Then I have a follow-up.
So yes, we believe that you can safely and responsibly reclaim community. Particularly the most important aspects of community are protecting kids and giving them opportunities to develop and grow and socialize. There's no easy answers to any of these decisions. Either option is a very tough option that exposes us to some level of risk. So, for example, if you close schools, then obviously kids are at home, and kids are, that creates some developmental challenges, some social challenges, but that also it probably increases their risk of drug abuse and child abuse, drug usage, suicide, and other negative and that also has other negative implications. We see those kinds of items mentioned in the American Academy of Pediatrics report, and we are working as best we can right now to understand what those risks are locally in Shelby County when kids are at home and exposed to those risks. If you open the schools, of course, that presents another set of risks. The risk of transmission of COVID is real, and the significant negative implications from contracting COVID are real, as we've been talking about since March. So there are no good choices. There are no good options. What you can do is try as best you can to understand the data and make informed decisions and trust the leadership. And so we're trusting and deferring to the leadership of the school districts to come forward with plans that they think are safe and responsible for helping and supporting kids and families. And so that means that from time to time, different school systems and their leadership will come to different conclusions. But there are no right answers. You want to say schools?
Bradley, your follow-up?
Thanks. And as a follow-up, I know it doesn't appear that today we'll have the final tripwire details, but is there any update about finalizing that, Dr. Randolph, as well as these numbers trending somewhat in the positive direction, potentially offsetting the need to even implement any of that?
So I think the Joint Task Force is prepared to take additional action to add layers of protection where the data show those layers of protection can help to reduce the spread. And so that structure is already in place. The tripwire document was an additional document to add to the mix, but that structure is already in place should the need arise and the data suggests there are additional layers of protection that need to be taken. For example, just as an example, that structure is already in place. You saw the action on with respect to bars and with respect to other social settings like clubs. So that process is already in place and working. One of the really important things in the tripwire document was more discussion, frankly, around schools and so forth, but you now see more discussion around schools in the latest health directive. So I would suggest that everyone look at the latest health directive because now there is additional information in the latest health directive around schools. So with all those things, there is a lot of guidance out there, and of course we expect additional guidance to be received constantly around schools from the state and from federal authorities.
Kendall Downing with WMC-TV.
Hello, everyone. I was wondering if the health department could talk about if there is you mentioned tripwires, but is there a specific number of new cases daily or a specific rate of transmission that would cause the department and members of the task force to say that schools should not reopen or schools that were in session should close? And then I have a follow-up.
So I'm going to say real quickly, and then I'll defer to Dr. Randolph around the tripwire document. We are not within range of the numbers that are contemplated in that document. And so that document does not come into play at all in this period, and we hope not ever. And so the tripwire document talks about numbers that are much more than where we are right now. So it does not come into play at all in this current period.
So with that said, I would encourage everyone, particularly the schools, to pay attention to the current data and make your decisions based on the current data countywide and within your municipalities. Also, I would encourage you to really focus on the health directive, because that will provide you with what are the current recommendations, requirements, or guidance that's out there, and not focus on the tripwires, because as Mayor Harris said, we're nowhere near those in terms of data and data to be used to drive decisions.
Kendall, your follow-up?
Yeah, well, one clarification. Is the document finalized and available for public viewing? Has that document been completed?
It is in the process of being completed, and it's my understanding that it will be completed sometime this week.
Okay, and then my other question has to do with contact tracing. What has the health department advised school districts about how each, maybe this would be colleges and K through 12 schools, they need to be doing they need to have someone to do contact tracing system wide, correct? Could you just talk about that?
Well, the process in terms of contact tracing in general, and the principles apply to whether you're a school, or employer, or any other entity. When there's a case and you know that you have someone who have tested positive in your particular facility, school, etc., the health directive that was recently issued requires that employers notify the health department of that case. And also, we are asking that you identify those who may have been exposed to the case. And the reason for that is because you know your particular setting, you know your classroom, you know who's in the classrooms. And by the time that the health department receive results sometime from the lab healthcare provider, there have been several days in delay. In order for contact tracing to be effective, those who have been infected need to be identified and isolated. Those who may have come in contact with those individuals who are infected need to be identified, need to be contacted, communicated with, and placed in quarantine and monitored. The quicker you can do that, the better you are in preventing the transmission, because you won't have someone walking around who's been exposed, possibly infected, infecting other people also. So we are asking the schools, we're asking the employers to be able to identify those who may have come in contact with someone who's positive. Even in the restaurants, the whole reason why we're asking restaurants to keep track of their patron is lists and people who have visited there, because in case we have an outbreak, we can identify people who may have been exposed so we can contact them and trace and monitor them.
Jacob Steimer with the Memphis Business Journal.
Yeah, my question was, Dr. Randolph, you said that you've seen some improvements with the labs. Can you quantify that at all? I think the last we heard, it was about 5 to 7 days as an average turnaround time.
And so it is actually in some situations it might have been longer than that. Now it's better. Now in some instances we're getting it in 3 days or less. Of course our goal would be to get results within 24 or 48 hours. We're not completely there yet, but that's the goal that we're striving towards. And so for example, the 500 or so cases that we report today is a result of 300 and some cases being reported by one lab at one time, all in an attempt to catch up with their backlog and bring things up to date.
Jacob,
Okay, thank you.
Jacob, did you have a follow-up?
No.
Great, thank you. This concludes our questions at this time. Are there any closing statements from any of the panelists?
So I would just remind everybody to just mask up. Don't wear the mask on your chin like this. Don't wear the mask on your ear like this. But wear the mask to cover your nose and your mouth. Thank you.
Thank you, everyone. This concludes today's briefing. Please stay safe and healthy, and we will see you on Thursday.